Stroke is an impairment of brain function caused by disturbance of blood flow to the brain. The treatment depends on the type of stroke. The majority of strokes, which is about 85%, is caused by a clot. Stroke treatment starts as quick as possible to get the best outcome. The clot-busting injection that we give needs to be given within the first 4.5 hours. It is likely in this day and age to recover from a stroke and lead a life that is relatively more independent than it used to be. So more people are recovering from stroke, and we like that. At the moment we have between 1,000 and 1,100 strokes a year in Lincolnshire. The majority of these come to Lincoln County Hospital. The current service provides an excellent care to stroke patients. Some of these clinical standards are not met because of the staffing crisis, which is not unique to Lincolnshire. We need to bring all these stroke specialists together so that we both can work from one place to provide better care for everybody. We will be more likely to attract new doctors and nurses and therapists to come and work in a unit that is better staffed than two units that are less staffed. The previous experience with the Heart Centre shows that the travel times are not as bad as we thought. Patients manage to come here and be treated on time. The other thing is obviously there are more patients come to Lincoln at present, and it looks like there are more patients will be treated more quickly if everybody comes to Lincoln than the other way around. What I would like to say to our patients and their families is that people who come to a centre of excellence will do a lot better. Eventually leave the hospital with less disability and are less likely to die in hospital, also less likely to go into a care home. More people with high blood pressure have strokes. The older the patient is, the more likely they are to have a stroke. Other risk factors like irregular heartbeat or diabetes or kidney disease can increase the risk of having a stroke, and people can protect themselves from stroke by controlling these risk factors, not smoking, drinking less alcohol, taking more healthy lifestyle, including diet and exercise. The obvious signs are usually included in what we call the FAST test. If you think someone is having a stroke in front of you, their face is unequal on one side, so either drooped on one side. If they have arm weakness, you ask them to raise both arms. If their speech is slurred, incomprehensible, then the T is time to call 999. That time is crucial for us to be able to save as much brain as possible.